sky. But anyway, junior doctors, they have announced another strike. The next one will be the longest in NHS's history. Let's have a little look, shall we? Get the calendar up for those of you that are watching. So it's from the 7 a.m. On the 20th of December right through to the 22nd of December, and then again the 3rd to the 8th of January. So, yes, they will be working some of those key dates over Christmas. But again, look at that. Many days they will not be working. This, of course, you'll be familiar by now with the fact that actually they've been requesting a 35% pay increase. They want pay restoration back until I think it's 2008. The latest offer that they got was an additional 3%, which they have now gone on to reject. Are you still supporting the junior doctors? I'm interested in your thoughts on that. But Jacqueline, are you?
No, I'm not, actually. I mean, and this is why we've had to sort of bring in these minimum service levels. I mean, I just find it astonishing as somebody who actually spent about 13 years negotiating pay and conditions in my former life, would ask for 35%. It was clearly never going to be... You're never going to be able to afford to do that for the NHS. And you're not going to be able to do it in the public sector. Most private sector pay rises would be nowhere near that. So I think it was unrealistic. I think it was amateurish. If the BMA were representing me, I think I'd want to change whoever the negotiators are. However, an offer has been made, and I think we'd all like the doctors in the NHS to get paid an awful lot more, but it is where it is. So you know, they're doing it with a sort of mantra, well, we're doing this for patient safety. Well, they're clearly not doing it for patient safety. We've got more than 7 million people actually on waiting lists. We're now going to be in a position, even after these earlier strikes, where that's going to be added to. So I cannot see where the safety of the patient comes in when you're actually making them leave even longer to have their operations or to be seen. So I'm just very, very unhappy about it. And in most countries around the world, and certainly across Europe, there are minimum service levels that are in, and therefore the patients at the time are then not affected.
Peter?
First of all, I want to explode the myth that it's somehow uncaring to go on strike. I've taken part in industrial action. That was when I was a newspaper... I've taken part in industrial action when I was a newspaper reporter, and I didn't do that because I had antipathy to the readers. I did it because I cared about the product and I cared about the readers. And in something much more serious, like healthcare, it's just the same, even more so. Doctors are upset because they care about patients and they're concerned about the quality of care. Both sides also have to get to a deal because feelings have been inflamed on both sides. Doctors after 35%, they're not going to get that. As I understand it, no mainstream political party has come out in support of the 35% pay restoration, which covers several years. The grim reality is most of us are a bit poorer after COVID and the inflation crisis and the events of the last few years. I think the best thing the government can do, which they've blown very hot and cold on, is negotiate in good faith. The new Health Secretary, I think, is trying to do that and adopt more ameliorative language. Steve Barclay, her predecessor, started like that, but then ended up pointing the finger and calling them militant, which I don't think really helped come to an agreement.
But if they won't budge from 35%, if all they'll say is it's 35%, 35%, 35%, 35%, isn't that a little bit militant?
No, I think in all negotiations, you go in with a number and then you try and reach agreement. But I don't think having a starting position is in itself militant.
Do you think the 35% is a reasonable starting position?
Relative to the rest of society, that they're not going to get it, and I would take that down because I've never met anyone in the last year or so who's had a 35% pay increase.
Let me, before I bring Jacqueline in, because you say about being on strike, I mean, you know an awful lot about trade unionists, all the rest of it, but in Scotland, they've had a record 12.4% pay increase for junior doctors. This was together with a 4.5% that had been previously awarded, so you've got a 17.5% there. So why is it good enough in Scotland, those kind of figures, but not good enough in England?
Well, I don't know the fiscal position of the dissolved government in Holyrood, but if you've got a precedent of 12% and then in Scotland, then in England, you've got a demand for 35%, that would seem to kind of set the parameters for having a discussion. Because, again, the point is, having been on a strike, the goal is not to do that forever, making yourselves poorer and your service users, in this case patients, worse off as well. The goal always has to be to reach an agreement. Otherwise, if you're not seeking agreement, that would be militant. And I think both sides can reach agreement, but it does require negotiations in good faith.
Jacqueline, I mean, you know an awful lot about trade unionists. You were like what I would call a shop steward.
Yeah.
So what, I mean, he's saying about, oh, you know, these people are going on strike not to cause harm, but on the contrary, to provide an ongoing service to people because it will help them remain in their sector.
Well, look, the fact of the matter is, the BMA unfortunately has become militant. The BMA used to negotiate far better pay and conditions for their members a long time ago, and they were very well-respected trade union, actually, representing doctors. I think what you also need to do is separate out. People think that junior doctors are the doctors that are just starting, and I think it's the wrong terminology, I think, which they're looking at, because it's any doctor that, from when they're starting, they've graduated, they're going, you know, starting work in a hospital, to the level where they then become a consultant. So that pay range is actually quite vast. What's also not mentioned, they're talking just about basic pay, and that's important, but equally, like we had in the airline industry, you will have payments for on-call. You get extra payments because you're working on social hours. We work over weekends, you work nights, you work all of these things. So you're then looking at the pay package, which the BMA never mentioned. You're also looking at the pensions that our doctors and our health service workers get, because the doctors aren't employed by the NHS. They are contracted to the NHS. They've never been employees. And so when you look at the overall package, including their pensions, etc., it's actually a good package. I'd like to give them more, but we have to cut our cloth. And I think they've made an offer. I think the grades are going up about 3,000, 32 to 37 at the lower end, from 43 to 63, and that's without all the add-ons. And I think good negotiators could have done something perhaps slightly differently and looked at where they are, maybe where the economy is in another 12 months' time.
By the way, that Twitter poll I mentioned, it has actually closed. Sorry about that. But the results have come in. So we were asking, do you support the junior doctors going on strike? Apparently, get this, everybody, 14.2% said they do support the strikes. And 85.8% said, no, you don't. You're divided on this at home. Leslie says, I totally support the strike and the junior doctors. 3% would be a pay cut. What on earth are the government thinking? You're saying the junior doctors must be eyeing up Australia, while simultaneously you suggest that overseas doctors with perhaps inferior training are eyeing up the UK. She says it's simple, pay our junior doctors more. That's 3%, by the way. It was an additional 3%. It wasn't just 3%. Paul, on the other hand, he's having none of it. He just says, sack the lot of them. Well, who would care for you then, Paul, when you went into the hospital? If you just sacked a load of people because you don't agree with their pay demands, what would you replace them with? Keith says, look, at the end of the day, they knew the rate of pay when they took the job. And I do think that is quite interesting.
They didn't know the rate of inflation, though. That's codswallop, I'm afraid.
We've had inflation for forever.
No, we haven't had inflation at 10% forever.
We have had high inflation. When I started work, we've had huge levels of inflation and expensive mortgages and all sorts of things over my lifetime. Nobody wants high inflation, but we know what caused it as well.
It is unprecedented in the last 30 years to have inflation at 10%.
Yeah, we know that. So help me understand your thinking then, because the pay restoration goes back to 2008. So I think, Keith, I'll speak on your behalf if you don't mind. Keith, my viewer, what Keith is saying is that when they took the job, they knew that rate of pay. Now, most junior doctors, in fact, pretty much all of the junior doctors, none of them would have been there in 2008. So this cohort of junior doctors have joined post-2008. So I think what Keith is saying is the salary that they took on was the salary that they took on. So why would those people now be entitled to go all the way back to 2008 and have incremental pay backdated essentially at the levels of that? What's your recent 10% inflation got to do with that?
For two reasons. First of all, most of us in any walk of life, you don't have exactly the same role. After 15 years, you tend to progress with one organisation or move to a different one.
Well, you're not a junior doctor after 15 years.
Well, we don't know that. But then
you do know that.
No, Jacqueline did describe it correctly.
It's between 8 and 20 years is these up to consultant level.
Well, I thought
so we've got very senior doctors, which are called junior doctors.
No, Jacqueline did set it out correctly. It's anyone below consultant level.
I thought it was you had 9 years of experience, and once you got into your 10th year, you were outside the parameters of being a junior doctor.
No, they still call them junior doctors. This is why I'm saying it's misleading in a way, because the public, you could sit there and you think, oh, it's people who've only been in for a few years, but it's actually people, doctors who've been practising, and then they get to a consultant level. Then they move out of this what's called a junior doctor, being a junior doctor.
Well, that's the first point of call that I'd be starting within these negotiations. I would want my job title to change.
Yeah.
If what you're saying is you can have 15 years of doctoral experience, 20 years.
Yeah.
I didn't realise you were still called a junior doctor. I thought the cut-off was about 9 years or something, and then you start branching out into your specialities or whatever you do. I would be starting there. I wouldn't want to be known as a junior doctor. So we've got to the bottom of that point.
May I answer your other point briefly? And I must apologise to Keith for being discourteous, Keith,
you don't mind.
and your viewers.
Keith's all right.
So, first of all, over the course of 15 years, one's role in any organisation, the media, a dustman, whatever, tends to change, or you change jobs. But secondly, none of us know what inflation will be like in 15 years' time. And I think in effect, it would have been for a quote-unquote junior doctor to sign on a dotted line, because at that point inflation was 2, 3, 4, 5%, only to find out inflation is 10 to 12%. So I think
it's only been that level in the last couple of years.
Yeah, but we're all worse off. And I'll tell you, let me give you one stat, because I know you want to move on.
I don't want to move on. I want to try and get to the bottom of it. Inflation has
only
only been...
You can't use inflation as a negotiating tool. We never know. I negotiated for years. We didn't know what the inflation rate was going to be in 5 years' time. You do a negotiation and you do it at the present time, and you hope that it remains reasonable. Unfortunately for us, we had COVID, then we've had all the energy crises. So a variety of things have kicked in, which were not probably expected if we go back to 2018, for example. But we are where we are, which has been hugely costly. So it's not making an excuse, but it's just keeping it in proportion of when you're negotiating, you can only negotiate on what you think you can get. Good negotiating, what you can get, and looking at the climate as it is and hoping that the climate in the next few years will remain stable.
But I'm not sure I quite agree on that, because that's assuming everything is just a snapshot of today, and you have no information about the future. Food is up 30%.
Now let's stick to the doctors, though.
Food. Well, we all buy food. Doctors buy food.
He's on about that. He's on about the costs that are incurred by doctors.
I don't
disagree. Food prices are up 30%. And we know that inflation is not going to be... The Bank of England target is 2%. So we know it's not going to be that tomorrow. It's tracking down relatively slowly. So we know inflation is going to be what experts call an elevated rate for probably at least another 1 to 2 years. So that's where I part company with Jackie, because I think you do have to take into account the kind of economic forecast the next year or two, rather than just negotiate on the basis of today's information only.
Yeah, but what you've got to do as well, you've got to take into account this is the NHS in the public sector. Once you start giving more and more and more, say, for example, in this area, equally people are saying, but we need more money in the frontline services in terms of the treatment we receive and the equipment that they want and the latest,
But this is less and less in real terms.
No. I mean, we've never spent as much as we have now on the National Health Service. I mean, in my view, as I've said for many years now, we need to look at how this works, because it's not working, and it just seems to gobble up funds, and we seem to put sticking plasters over it. I personally, and I've said it for years, I've lived in 4 European countries, I would look at a mixed service whereby their insurance companies are involved, where there is a small element of that cake where people can't afford anything at all, because this is the only country that has this service. And it's a political football. Until people are prepared to sit down and look at it and say, let's take this out of politics and see how we're going to move this forward, I don't think we're going to see any improvements.
I'm an optimist. To privatisation.
By nature.
Privatisation by the back door, suggests Peter on that one. Ron says, give them 15%, but lock them into the NHS for the next 10 years.
Yeah.
Would you agree with that? Christine says, I've worked in care all my life, but as a carer, our wages are low. But what you're saying is you're going into that profession because you care. You're suggesting that you wouldn't go on strike. John says, oh, well and good, you lot supporting junior doctors if you're fit and healthy. What about if you're perhaps not? Caroline says, junior doctors don't care about their patients. I think that's a bit harsh. I think they probably do. Are you a junior doctor watching this? What do you think? Tim says, I think this is absolutely shocking, them going on strike again. And Glenn says, Michelle, you are being naive. All of this is just bandwagon jumping and not wanting to be left out. That's why they're going on strike, because everyone else is.